My name is Riley Glad, and this is my Capstone Synthesis project for nursing N495. I live on Camino Island with my husband and my 7-month-old son. I work in the neonatal ICU at Providence in Everett, and I've been a nurse for 4 years next month. The last 3 years have been in the NICU. My clinical location for this semester was at the Safe Harbor Free Clinic in Stanwood. I'm going to start by talking about what according to the AACN Baccalaureate Essentials in our Nursing 495 syllabus, what is a BSN prepared nurse? A BSN prepared nurse is someone who is prepared to practice with patients, including individuals, families, and groups, communities, and populations across the lifespan and across the continuum of healthcare environments. They understand and respect the variations in care and the increased complexity and the increased use of healthcare resources inherent in caring for patients. They are able to integrate delineated knowledge and skills into their professional nursing practice, and they have developed and refined their knowledge and skills necessary to manage care as part of an interprofessional team, and they've been able to build clinical reasoning, management, and evaluation skills. The differences between an ADN and BSN prepared nurse are subtle. An article that I found from 2013 argues that BSN prepared nurses provide more thorough, comprehensive care that is reflected by improved patient outcomes and decreased mortality rates. But most of the other studies that I found relating to this topic of nurse education level have been less conclusive and more qualitative in nature. If asked, many believe that BSN nurses are more prepared for patient care and are better critical thinkers than ADN nurses. My ego was slightly mollified when I was reading articles that though their findings still supported continuing your education to the BSN level, found that both degrees had their own unique characteristics that combined quality patient care. But it was suggested that more research needed to be done to identify other variables and traits that can be associated with good nurses rather than focusing on pre-licensure preparation level. I'm very proud of the ADN program that I graduated from, Everett Community College, and I'm also very proud of what I've accomplished so far in my career. I'm a little embarrassed to admit that I've harbored a little resentment towards BSN nurses because for some reason they seem to think that their higher degree makes them smarter and better nurses than us who graduated from an associate program. I've heard a lot of them say that BSN nurses are better at critical thinking, but critical thinking, like learning critical thinking as a concept, is a mandated part of every accredited nursing education program, and critical thinking is a difficult concept for many people to grasp. It's a process that has to be learned and developed over time and after innumerable practical applications. So I don't believe that critical thinking is one of those things that differentiates the associate from the bachelor, but because of this prejudice that I had, I came to this BSN program as a reluctant learner. I was being forced by my employment contract to have earned my BSN within 5 years of being hired. I didn't want to do it. I didn't think I needed it. I was here grudgingly. But this program is great, and its flexibility has allowed me to be successful in a way that I didn't think was possible. I was working full-time and pregnant, and then last December I had my son, and I was working part-time and had a new baby. It's very busy and stressful part of my life, and I'm happy to be putting it behind me. However, in the process of going to school and having a busy life, I did learn things and I did change. I didn't want to. I didn't want to learn and I didn't want to change. I thought, I'm a good nurse. This is not going to help me. This is not going to make me better at my job. This is costing me money. This is costing me time away from my family. This is causing me to clench my jaw. This is a waste of my time. I don't want to be here. And I held on to that kind of resentment for a lot of the program. And then I remembered something that one of my nursing instructors told me my very first quarter of nursing school, which is, you don't know what you don't know. And so now, having been forced to reflect upon my experience for a substantial part of my grade, I will now go into how I've grown and what I've learned. Because I realized that I didn't know what I didn't know. My clinical experience took part in a free clinic in Stanwood, where the patients are mostly middle-aged, uninsured, minimal English-speaking adults. I am happy to say that some things in nursing are like riding a bike, like taking an adult manual blood pressure, which I haven't done in 3 years. But after my second and third one, I was like, I got this, I'm back. Also, I am not used to my patients being able to talk back to me. So it took me a little longer to remember that I needed to ask open-ended questions and then be able to quickly come up with appropriate and applicable follow-up questions to ensure that I was getting the full and clear picture from the patients. My learning goals for the semester were to re-round myself out as a nurse, I think, is kind of how I wanted to put it. I wanted to get to work other parts of my brain that I haven't had to work in a long time. So working with adult patients is a lot different from working with babies. And I wanted to be able to look at adult lab values and understand them and understand what they meant. So, and be able to interpret them correctly, and then being able to communicate with the appropriate people that needed to be informed and help with care following that. I wanted to improve my skills in collaborating with other disciplines and providers. I wanted to learn more about the different kinds of patients that come to a free clinic and a lot more about the resources we have to offer them. I wanted to learn more about the RN role in a free clinic and be able to provide good care and interventions based on current evidence-based practice, but also within reason at our facility. It was important for me to try to keep an open mind when interacting with patients from different cultural backgrounds and be able to provide respectful and culturally safe and competent care. I wanted to build on my adult assessment skills and improve my techniques, and just kind of use what I already had but improve. So get better at advocating for adults and communicating better. But I also wanted to learn more about how a free clinic runs. So Safe Harbor Free Clinic in Stanwood is the only clinic north of Seattle, like until the Canadian border. So they get patients from far away. We get patients from almost Canada and Oak Harbor and Anacortes and Snohomish and Everett and all sorts of places. And kind of, but I also wanted to learn how you deliver care to a more transient population, like, because, you know, they might come to the clinic once because they're sick, but like they might never come back. So how do you give them the resources they need to be healthier and more successful people if, like, you have to kind of be aware that they might not come back again, and how you do that. So it was really important to provide safe, competent, and evidence-based nursing care, but also impress upon the patients the value of self-efficacy and the value of having good patient education that is culturally and developmentally appropriate. And so I feel like I really wanted to do that. I wanted to be able to give them resources, have them understand them, have them follow them, and then have them come back so I could see like how my nursing interventions worked. And I was able to do that with our the chronic care program that Safe Harbor runs. It's patients who've been to the regular clinic, but then have been diagnosed with diabetes or hypertension or high cholesterol, and so we refer them to chronic care, where they come every 3 to 6 months, depending on like how they're doing, and they get reinforced education and follow-up because they need major compliance and lifestyle changes in order to be healthy and successful. Working with chronic care patients really opened up my eyes to how important health promotion and disease prevention can be. So that goes along with population health, and that, you know, as a society or like the general population, we have an issue with obesity and nutrition status and those types of things. And the idea is to identify a health problem or a potential health problem and give the patient the necessary information and resources so that they can take care of themselves, and not so they have to keep going to the doctor because they're sick all the time. And let them know that, like, if they don't take care of themselves, this is what can happen. There are complications from ignoring your diabetes or your hypertension. You don't have to get your toe amputated if you keep your blood sugars within a normal range. You won't have heart disease or heart failure if you can avoid salt and high blood pressure and elevated cholesterol. Like, sometimes, you know, things like that are, you know, things run in families. But so the clinic works at a primary and a secondary prevention level, I feel like, kind of. So at a secondary level, because we're working with patients that have these chronic illnesses, and so we're helping them prevent the we're helping them even though they're already sick. Like, we can't prevent the diabetes, they've already got it. But then we're kind of working at a primary level where we're trying to prevent complications that happen as a result from a disease they already have. And that's by educating them and reinforcing education and having them follow up and keeping track of their health. And so that was really important. During the course of my time here, especially my first semester when I took nursing, research, and informatics, I learned how to first evaluate resources. Is this a credible resource? Like, what is its does it have a place here? What is its value? Can it be used? And so I feel like that I learned a lot in that class, because Dr. Google is not always a great thing to refer your patients to. Oh, well, you can look that up. Well, if you Google type 2 diabetes, you get 1 million results. Well, how many of those results are good? And even if some of them are good, how do they even find the good ones? Like, how do they sort through all the information that they have available? And how do I expect them to be able to do that when I can't? So it's important that as a nurse, I have a certain amount of scientific and information literacy, and that I can sort through and decide whether or not information is credible or not. This program, I took the cultural safety class, which I'll admit I thought was going to be kind of a drag. I learned a ton. Cultural safety was not a thing that was on my radar at all when I started the nursing program here. I work with a lot of Hispanic and non-English speaking patients, and we talked about cultural competency in the nursing program I was in before, but cultural safety, that's only one part of cultural safety. So it's important that you're delivering culturally competent and sensitive care, but it's also important that as a nurse, I am aware of my own biases and my own cultural self, so that I can kind of check myself at the door and be like, I'm going to be taking care of someone from this culture or this population of people, and I need to make sure that if I have any biases toward them, that it's not going to affect the quality of the care that I'm giving. And cultural safety also, part of that is that the patient feels like they're getting safe care provided to them. So it's not just about me and the care that I'm giving, it's about how they feel about the care that they're receiving. And so that was a whole new idea to me, and one of my goals was to really integrate that into my practice. And I'm going to be able to take the idea of that back to my job in the NICU, where I see a lot of non-English speaking parents that I have to teach how to take care of their baby. So, population health, although I knew what it was not something that was like super on my radar, but I also learned a ton about that. And then my other classes just reinforced that awareness. Well, this is a huge problem for everybody. How are we going to fix it? The nutrition status and the homelessness and the food insecurity and the low socioeconomic status. It's not just a ethnic problem. It's a general population problem that needs to be addressed. A lot of the people that come to the free clinic, their immigration status might be unknown, but we also get a lot of U.S. citizens who come to the clinic because they're not old enough to qualify for Medicare or Medicaid, or they lost their job and now they don't have any insurance and stuff like that. So I'd increase my awareness of population health issues and the potential resources that we have to help those people. For the UCOR standards that they want to make sure that a BSM prepared nurse has met and understands and will be able to integrate in their practice. I touched a little bit earlier on critical thinking. I was a nurse that's already been in the workforce. I think I have pretty good critical thinking skills, but this program has shown me that possessing such skills is only half the battle. Knowing when to apply them is the next step. These skills were furthered by most of my classes that I took during this program, and each of them contributed greatly to my ability to reason, evidence and context to increase my knowledge, ethical reasoning, and ability to innovate in imaginative ways. Scientific literacy and information literacy, I didn't even know what those things really were before I was here, and during the course of my classes, discovered kind of that though I was pretty scientifically literate and had pretty good information literacy, I actually learned a lot about those two things. Scientific literacy is a broad concept. and so is information literacy. But I felt like I made a lot of progress in the information literacy department, and that comes along with the first semester nursing research and informatics class, like where you learn how to find scholarly resources and understand them and evaluate their validity and determine their accuracy, and you can sort by type and information. And the most challenging part is being able to decide if the course or the resources are credible. But like I said earlier, like we have difficulty with this, so we need to be really careful when we're giving information to our patients. Communication is something that I felt like I was good at already, but that is something that everyone can always be improving on. And just when you think you got it down, you work with a whole new group of people, and you have to learn how to communicate with those people because they communicate differently from the people that you're used to. But I learned that specific and clear and closed loop communication is really important. So the interventions and care is delivered correctly and in a timely manner. And that as a nurse, you can never assume that something's been done. You need to verify that it's been done. So asking someone if they did it is important. Like if you delegate a task to somebody, following up with them to make sure that it got done, and what the result was, and if you need to do something based on the result that they give you. I had some difficulties with some of the classes and assignments that were a part of the program. I didn't agree with some of the ideas and concepts that I was being asked to learn about or write about, or But something I realized was that I can learn a lot from someone who disagrees with me, and someone who disagrees with me can learn a lot from me. Conflicting ideas are not necessarily bad, as long as I'm able to be civil and open-minded and other people are able to be civil and open-minded. People can learn a lot from each other, even when their viewpoints are at odds. You can learn something from anyone. It's important to keep yourself open to learning opportunities and not shut down just because ideas are different from your own. Cultural safety, advocacy, informatics, information literacy, scientific literacy, critical and creative thinking, all of these things that were the end goal of my learning here at WSU, I felt like I made progress in. I don't know how successful I was in all of them, but like I was saying at the beginning, I came here, I applied to the program, I didn't want to be here, and I didn't think I was going to learn anything, and I was really irritated that I had to do this, and I've learned a lot. I appreciate the value of evidence-based practice and research. I appreciate all the things it takes to be a nurse manager, which I never want to do ever, but I have more respect and sympathy for my nurse manager because of having to take leadership and management classes. I'm hoping that I can take all the stuff that I did learn and all the ways that I did grow back to my unit and create positive changes there.